At any time, organizations really have decisions to make around how to leverage the technology to meet both the short-term needs of the organization. How do we take care of patients this week and next month when they show up in the emergency room or we need to schedule an operation? And then also, what is going to support our needs in years to come? And so the question is, how do we modify or update our current EHR to best meet those needs going forward? The whole goal of trying to figure out how best to get health technology, for example, our EMR, Cerner, Oracle, to work best for the folks who are using it in their day-to-day work.
My experience as a nurse was that there was a lot of clicking around, a lot of trying to find the info that you wanted, and learning how to navigate it. It really impairs your ability to sit with your patient and see them because you're so worried about the documentation and making sure you check your boxes and fill things out. But when I have a difficult patient scenario where I'm in there for most of my shift and don't really see my other patients, so the charge nurse is monitoring them, I still stay till 8, 9 o'clock charting, which is 2.5 to 3 hours after my shift is technically ended.
Our EHR itself, it's just a little clunky. It feels like there are some pieces missing. So an example would be when I discharge a patient, I end up in 4 different screens trying to go through to complete all of the discharge piece of this. And it's just a little bit different than the current Cerner build that we had before, where I could do it all from essentially the workflow within my note.
From a revenue cycle perspective, we want to really charge and bill for what our clinicians are doing. And so having that built in a way so that they're driving us and we just then do our part of coding and billing that. We didn't optimize Cerner. We didn't optimize the build or the processes. So, in other areas we've customized it probably a little too much. The good thing we've done is really get it out in our THOs on the same platform, and that obviously is a benefit to our patients.
The best part, I think, of this shared support and shared EHR model is, the shared, first of all, the ability of us to essentially have universal health records for specifically our Alaska Native American Indian beneficiaries, but also, patients who, move throughout the state tribal health system.
Our system today could be optimized, but I think there are core things at the center that need to be rebuilt.
I want a tool that works, and I want our providers to have a tool that works well for them.